Good afternoon, everyone. Thank you for joining us today for Social Security Disability Insurance, the Impact of Work on Benefits. Today's webinar is sponsored by Accorda Therapeutics. And now I'd like to invite my colleague, Nakia Matthews, to offer some housekeeping tips.
Good afternoon, everyone. The audio for today's webinar is being broadcast through your computer. Please make sure that your speakers are turned on and turned up. You can control the audio broadcast via the audio broadcast panel, which you see below. If you accidentally close this panel or if the sound becomes unintelligible, you can close and reopen the audio broadcast panel by going to the top menu item, Communicate, Join Audio Broadcast. If you do not have sound capabilities on your computer or you prefer to listen by phone, you can dial the number that you see here in the meeting code, but you do not need to enter an attendee ID, and I will paste this number into the box. Real-time captioning is provided during this webinar. The captions can be found in the Media Viewer panel in the lower right-hand corner of the webinar platform. If you'd like to make this Media Viewer panel larger, you can minimize some of the other panels like Chat and Q&A, and conversely, if you don't need the captions, you can minimize the Media Viewer panel. There will be a question and answer portion at the end of the webinar. You can use the chat box or the Q&A box to send any questions that you have during the course of the webinar. You can send them to Katie Metz or to myself, Nakia Matthews, and we will direct the questions accordingly during the Q&A portion. If you are listening by phone only and not logged into the web portion, you may also send in your questions by emailing Katie Metz directly at kmetz, M-E-T-Z, at ndi-inc.org. Please note that this webinar is being recorded and that the materials will be placed on the NDI website at www.realeconomicimpact.org/financial wellness. And for those that have asked, the PowerPoint will be available around 4:30 at the end of this webinar on the website. If you experience any technical difficulties during the webinar, please use the chat box to send me, Nakia Matthews, a message, or you may email me at nmatthews@ndi-inc.org.
Thank you so much, Nakia. Good afternoon, everyone. My name is Elizabeth Jennings, and I'm the Director of Training and Technical Assistance at National Disability Institute. I'm very excited to join you today, not only as today's moderator, but also as today's presenter on Social Security Disability Insurance. Today we're going to talk about financial wellness and individuals with MS, how you qualify for Social Security Disability Insurance, the impact of work or earnings on SSDI benefits, where to turn for assistance in making a return to work and better understanding your benefits. We're going to leave some time for questions and answers, and we're going to give you some suggested next steps so that you can make some decisions about your own return to work. I'd like to offer a special thank you to today's sponsor, Accorda Therapeutics. Without Accorda Therapeutics, our MS Financial Wellness Series would not be possible. National Disability Institute is a national research and development organization with the mission to promote income preservation and asset development for persons with disabilities and to build a better economic future for Americans with disabilities. All of our efforts focus on understanding poverty and the link to disability and finding ways that we can support individuals in improving their financial future. We've done this series now for several years, and we focus on financial wellness. We define financial wellness as the state of a person's finances with the intent of working towards financial behaviors that limit stress and the impact of stress on one's daily life. We focus on this for individuals with MS, and we consider that there are a lot of several components to financial wellness, strategies that you can take on to improve your financial wellness. They include being financially literate, accessing affordable financial services, utilizing favorable tax provisions, budgeting, understanding work and long-term disability options, accessing available health care subsidies, building and maintaining assets, and understanding public benefit rules. We talk about all of these components throughout the series, so if you haven't had a chance to participate, I encourage you to check out our archive and ask that my colleague Nakia Matthews post that link into the chat box so you have it. The reason why we focus on the link between disability and poverty is because the poverty estimates are so high. For individuals without disabilities, 12.4% had income below the poverty level over the past 12 months in 2011. For individuals with disabilities, the rate was more than 2 times that. 27.8% had income below the poverty level. No group in America is really more in need and more deserving of economic recovery. However, many of the public benefit rules that support millions of working-age adults with disabilities create a dependence for income, health care, food, and housing. And this dependence on public benefits becomes a trap that requires staying poor to stay eligible. This really goes against the mission of the Americans with Disabilities Act. If you've never taken the time to read the Act, it says the nation's proper goals regarding individuals with disabilities are to assure equality of opportunity, full participation, independent living, and economic self-sufficiency. That last piece is really key to our mission at National Disability Institute and really to civil rights for all individuals with disabilities. Economic self-sufficiency is what we're going to be focusing on and what I hope you'll think about as we talk about public benefits today. So why is financial wellness so important? We know that it impacts a person's mental and physical health. It positively impacts their self-concept. It can change your status with other community stakeholders, and it directly impacts a person's quality of life. Before we started this series a few years ago, we did a study with our partners at the with our partners at MSAA, and we looked at a series of survey questions that was answered by over 2,000 individuals with MS. Our findings included the following. We learned that more than half, 55.1% of households, were earning less than $35,000 annually. When we asked about the ability to pay bills in a typical month, 32% reported they had a very difficult time paying their bills, and 46.9% reported having a somewhat difficult time. 43% of the people that responded reported that their financial status had affected their ability to access medical care at some point. Over 70% reported that they do not have enough savings to cover 3 months' expenses, which is a sign of whether or not you are financially stable. 67.1% reported that their finances were worse since their MS diagnosis, and 73.7% reported that they were not aware or have not used financial stability programs such as the Earned Income Tax Credit, individual development accounts, family self-sufficiency programs, or plans for achieving self-support. We've covered many of these in our financial wellness series this year, and we'll cover the rest in the sessions to come. So again, if you haven't had a chance to join us, I encourage you to take a look at the archives. We know that there are many financial wellness strategies that exist. We try to cover them throughout this series. Today we're going to focus on the use of work incentives. We're going to talk about work incentive planning and assistance programs and protection and advocacy programs. So let's dive into our information about Social Security disability insurance. As many of you may know, it's not the most exciting topic to talk about, but I'm really honored to have the chance to talk to you about it today and encourage you as we go throughout this session to submit your questions into the Q&A box. My colleagues Nakia Matthews and Katie Nuts will help us sort those so that we can answer as many as possible at the end of the session. Also, if we don't get to your questions today, my contact information will be available at the end of the presentation, and I encourage you to email me, and we'll get your answers to your questions as fast as we can. So the Social Security Administration has 2 programs to support individuals with disabilities who demonstrate that they have an inability to work at a substantial level. The 2 programs are Social Security Disability Insurance, or SSDI, and Supplemental Security Income, or SSI. Many people who receive these benefits, and I assume many of you on the line are such individuals, want to work but are unsure what will happen to their benefits when they do. and tend to get a lot of bad information just amongst friends and neighbors who aren't really sure how the programs work, which can be a real deterrent to returning to work. The Social Security Administration has built into both benefit programs work incentives that make it possible for individuals to test their ability to work and or work at varying levels and continue to receive some or all of their health and cash benefits. For anybody who's going to go on the rolls to apply for either Social Security disability insurance or supplemental security income, you have to prove two things. You have to prove that you have a documented medical disability that will last 12 months or longer or result in death, and prove that because of that disability, you are not able to work and earn at a substantial level. For this year, a substantial level is $1,040 per month, but hold on because we're going to talk about that more later. So substantial gainful activity is the test of what you can do for money. So it's the performance of significant mental or physical duties for profit. The amount of money that is the substantial gainful activity level changes every year. So you want to be careful not to commit these numbers to memory as they're going to change in just a few months. But for 2013, the SGA level for non-blind individuals is $1,040 per month, and for blind individuals is $1,740 per month. To qualify for Social Security disability insurance, you also have to meet some other criteria. Not only do you have to prove that you have a documented medical disability that will last 12 months or longer or result in death, but you also have to prove that because of that disability, you're not able to work and earn at a substantial level. It's always important to remember that you have to meet both of those. And I want to pause there for just a second before we go into the other eligibility criteria. You know, a lot of times folks don't understand that it's important to meet both of Social Security's criteria, a documented medical disability that will last 12 months or longer or result in death, and the inability to work and earn at a substantial level. I've often talked to folks who say that I'm 100% disabled, my disability isn't going to change, but only if that disability prevents you from working does it meet Social Security's definition. To me, the easiest example of this, and the one that I like the most, is if you look at Christopher Reeves. Nobody in the free world would argue that Christopher Reeves was a person with a disability. However, because he was still able to earn money at a substantial level, so he would not have met Social Security's definition of disability. So people always have to meet both. To qualify for SSDI, you also have to show that you have the required work credits. You have worked and paid into the Social Security system. The only people that don't have to have the required work credits are folks called disabled adult children. These are people that are disabled prior to age 22, are not legally married, have insufficient FICA or their parent has a higher FICA amount, and their parent's record is open, meaning their parent is deceased, disabled, or retired. So if I was talking to you as a person with a disability and I had become disabled at, say, age 12, I am now currently over age 22, but that's irrelevant. My disability happened prior to age 22, and it happens that my father is retired. So if I did not have enough FICA to pay in and I proved that I had a documented medical disability that will last 12 months or longer or result in death, and because of that disability I was not able to work and earn at a substantial level, I could qualify for SSDI. So those are the two groups that are coming onto the SSDI roll. People that have worked and earned and paid into the system, and individuals who were disabled before age 22 are not legally married, and their parent's record is open, meaning their parent is deceased, disabled, or retired. SSDI comes with Medicare. Medicare has three parts, Part A, Part B, and Part D. Medicare requires that you do a 24-month waiting period. Also for SSDI, there is a 5-month waiting period for cash benefits to start. few other important things to know about SSDI is that there is no asset limit. So if you're thinking about returning to work and then using your funds to save for an asset for the future, SSDI has no asset limit, so it's not a barrier to that. But SSDI does pay close attention to SGA, so we're going to talk about SGA a lot today. Anybody who comes onto the SSDI rolls is going to be required to go through a continuing disability review process. It's typically, it could be every 1 year, every 3 years, every 5 years, every 7 years. But everybody is required to go through this process. Social Security is looking to see if you have had any medical improvement. And what happens is you get a form in the mail, and Social Security is checking to see, do you still have a documented medical disability that will last 12 months or longer or result in death? And I always like to make sure people have a heads up about this, because sometimes the continuing disability review process happens while you're working, and it can create some stress, especially for individuals that have system diseases such as MS. So we're going to talk a little bit later about Ticket to Work, but I want to make sure you know one of the real benefits of Ticket to Work is that you won't have to engage in this process, the continuing disability review process. If you're coming upon this process and you're not sure what to do, we're going to give you some supports later in the presentation about where to turn, and of course you can always reach out to us at National Disability Institute. So let's just briefly retouch some important points about SSDI. SSDI is very focused on SGA, so we're going to talk about SGA quite a bit today. As you work and earn at the SGA level, you can come to a point where working at that level will take you off of the rolls, and we're going to talk about that later. And SSDI has no asset limit. So let's talk about what these work incentives are. There are many work incentives available under both Social Security disability insurance and supplemental security income. If you take a look at the two sides of work incentives, the SSDI side and the SSI side, you can see that although some of the work incentives are the same, many are different. And what's important to remember about SSDI and SSI is that they're two completely different programs. And what can often happen is people know about one of the programs and they share the information as if it applies to both programs. And that can get you into quite a bit of trouble. So we're going to provide you some individuals at the end of the session that you can turn to who are certified to provide you with good information. And you just want to always keep in mind that just because somebody says, well, I get Social Security and here's how it worked for me, they could be getting a totally different benefit than you're getting. So you always want to be careful about the information that you take in and how valid it is. So today we're just going to focus on SSDI work incentives because the survey we did noted that the majority of individuals with MS who responded received SSDI, not SSI. So that'll be our focus for today. We're going to talk about the following work incentives: the trial work period, the extended period of eligibility, impairment-related work expenses, subsidies, extended Medicare coverage, and expedited reinstatement. So the trial work period is a 9-month period where you are allowed to work and earn any amount of money and still keep your full cash benefit. You use up the 9 months any month that you earn $750 or more per month, and you do not have to use these months all in a row. You get a rolling 60-month period, which means that Social Security is going to look back at 5 years and see if over the 5 years you had 9 months where you earned over the trial work period amount. The trial work period amount for this year is $750, but it's important to know that just like the SGA amount, each year the trial work period amount changes. So if you had work in the past, you may have used up some of your months, even if you didn't earn over that $750, because that $750 applies to 2013. So the idea of the trial work period is that Social Security would like you to go back and try work. They want you to have a period of time where you can test your work skills. The ideal opportunity for the trial work period is a chance to look at a field or an employment opportunity that would really get you back to the kind of financial life that you're seeking for yourself, and to test yourself to the greatest extent possible. So to earn as much as you can, to work as much as you can, and to figure out, is this going to be the right next step for me? Unfortunately, many people don't realize that they have this time available to them, and so they use their child work period up doing small, odd jobs or seasonal work, or just returning to work because they really need to, because you really need to have some money coming in. But the trial work period can be a very powerful period of time. So if you're on the line and you haven't made an effort to go back to work yet, the trial work period can be a significant opportunity for you, and one that you would want to think about very strategically. If you're not sure about how many trial work period months you may have used up, a great resource for you is to request from the Social Security Administration a benefits planning query, a BPQY. The benefits planning query provides information about your cash benefits, your health insurance, any upcoming continuing disability reviews, whether or not they have down that you have a representative payee, and the work history they have on record for you, including the use of your trial work period months. You're allowed to request this from the Social Security Administration, and you can do so by calling Social Security's 1-800 number. It's 1-800-772-1213 between 7 a.m. and 7 p.m. If you're on the line and you're a service provider and you want to be able to help do this for those that you serve, you can do that as well, but you need to provide some consent for release of information forms, and we've provided that information for you there. I know that it's a lot to take down as we're going through the webinar, but we will post this webinar as an archive after the event. Also, the Social Security Administration has created a benefits planning query handbook. So if you are anxious after this call to get started, you can Google that handbook. It's just SSA BPQI handbook, and it should come right up for you and give you all the detail that you need. So the benefit of the BPQI is that it provides information including whether or not you have used up your trial work period. It's important for you to know that because you don't want to believe that you have this time to work and earn any amount of money only to find out that Social Security has documented that you've already used up your 9 months. So just as a reminder, the trial work period allows you to earn any amount of money and still receive your cash benefit. You get 9 months over a rolling 60-month period, and each month that you earn $750 or more for 2013, you use up one of those 9 months. When your 9 months are used up, you move into the next step, which is the extended period of eligibility. The extended period of eligibility is 36 months all in a row, and the time period starts as soon as your trial work period ends. So even if you're not working, even if you're not earning SGA, as soon as you use up that 9th trial work period month, the next month starts the extended period of eligibility, and the clock is ticking whether you're working or not. During the extended period of eligibility, Social Security is looking to see, are you working over SGA? For this year, that's $1040 per month for the non-blind, or are you working under SGA? SSDI is an all-or-nothing program. So if you're working and earning over the SGA amount, you are not entitled to any of your cash benefits. If you're working and earning under the SGA amount, you are entitled to your cash benefit. This is why you hear a lot of people in the community tell you, or you may have the belief yourself, I'm not able to work and earn over $1040. That's where that idea comes from. Sometimes you'll hear folks who say you can't work and earn more than part-time. You shouldn't work more than part-time. That's really a cheat. That's not something that you really need to abide by. The earnings limit looks to be, based upon SGA, $1040 per month for 2013. But there are opportunities to work and earn over the SGA amount and have it count as less. And that's where the work incentives come in. So the first work incentive we're going to talk about that allows you to work and earn over that $1040 per month and have it count as less is called impairment-related work expenses. IRWIs allow you to deduct the cost of disability-related items and services that you need to be successful at work. So an IRWI exists when it meets these three rules. You paid for the item yourself to go to work because of your disability. The real beauty about IRWIs is that it's a pretty gray area. If you have something that meets those three rules, I paid for it myself to go to work because of my disability, and the cost was reasonable, and you incurred it in a month that you were working, and you've kept a receipt or proof of payment for it, then it's something that you should put forward to the Social Security Administration as a possible deduction. Some examples of IRWIs are transportation costs, if you use paratransit services, or if your car is modified, or even if you are driving your own car but you have to drive your car. You're not able to use public transportation because of your disability. So for folks with MS, you may have some mobility issues, or you may be in a hot climate and being exposed to the heat would prevent you from using public transportation. All of those are indicators that your transportation costs are an IRWI. If you're taking paratransit, the cost is what you paid. If you're using your own vehicle, the cost is a mileage rate that Social Security posts every year. Other examples of IRWIs are attendant care services. If somebody helps you to get ready to go to work, or somebody comes on the job to provide you some personal attendant support. Medical devices, prosthesis, residential modifications. If you need to modify your home so that you can leave your home to go to work, or if you needed to modify your home so that you can work at home, all because of your disability. A really simple deduction under IRWIs is your prescription drugs and your routine medical services. So the money that you pay to go to the doctor, or the money that you pay for different therapies, or for your prescription drugs, all of those can be IRWIs. The list goes on, and on Social Security's website, there's an even more in-depth list, and you can look at that at your leisure. The IRWIs can be very powerful as you start to build up all of the receipts for the different items that you're purchasing yourself to go to work because of your disability. You may find that you have some substantial costs, and that means that you have more room to work and earn above the SGA level and potentially have it count as less than. Some features of an IRWI are that there's no time limit in using the IRWI. So if it's a cost that you incur every month, you can deduct it every month. They do not have to be a monthly expense. It could be something that you pay annually, and the cost could be deducted over the course of 12 months. Or it might be a one-time expense, and you could have the expense deducted over several months. I'm going to talk about reporting IRWIs in just a minute after we talk about subsidies. But subsidies are the second work incentive that we want to talk about. As subsidies also allow you to look at earnings above the SGA level and see if they can count as below the SGA level. A subsidy allows you to deduct the value of extra support you receive at no cost to you. So if it's something that you paid for yourself to go to work because of your disability, it's an IRWI. And if it's something that somebody else is providing to you to go to work because of your disability, it's a subsidy. So when an employer provides it, it could be anything from an accommodation, extra support on the job, extra supervision. You could be receiving extra breaks. Maybe you have fatigue during the day and you're allowed an extra 15 or 30-minute break. Or it could be that the employer acknowledges that you have lower productivity, but you bring other things to the job, and so that's an accommodation that has been made for you. Sometimes an agency will be providing support. An agency may help in securing employment. They may be the one that provides the accommodation somebody needs on the job. It could be support in getting to work or even on-the-job support. If you or someone you're working with is using a job coach, that's a great indicator that there's an agency subsidy at play, which is also called a special condition. There's two times when you can use subsidies. You can use them every month that they apply while you're earning income, but you can also use them when you're applying for Social Security disability insurance. So if you're somebody who is currently working, but your workplace has been making accommodations for you, and you know that your disability is progressing to the point where you may no longer be able to work, you don't have to wait until you're off the job to apply for SSDI. You can take a look to see maybe there's a subsidy at play which is bringing my actual earnings to less than the SGA level based upon whatever additional support my employer is providing to me. There's lots of times that you can look at your work to see if there's evidence of a subsidy. Certainly if your employer is providing accommodations for you, you're getting extra support from other coworkers, lower productivity. If you have different job functions than coworkers receiving the same pay for the same job, or if the job has been customized for you, meaning perhaps the employer took parts of a job and apply those to you, but other people do the full job, but this job's been customized for you. Also, if you're working with an agency, again, who's providing supported employment to you, a job coach, a living coach, or transportation support. You may be on the line wondering why on earth would I want to point these things out. I know that identifying these things within your work life wouldn't be a very self-esteem boosting process, possibly, but what you're showing Social Security is whether or not you're able to work and earn at a substantial level. If we go back to earlier at 3 o'clock when we started, if you recall, we talked about the fact that Social Security requires you to prove two things. You have to prove that you have a documented medical disability that will last 12 months or longer or result in death, and you have to prove that because of that disability, you're not able to work and earn at a substantial level. What IRWIs and subsidies are really doing is they're saying, okay, I know that it looks like I can work and earn above the SGA amount. I know that it looks like that based upon the earnings I have coming in. But if you removed my IRWIs, if you removed the fact that I have access to a doctor and therapies and have access to prescription drugs, if you removed the personal care that I receive, if you removed the access to different transportation that I have, if you removed all that, I wouldn't be able to do it. Or if you removed the fact that I found an employer who understands the value that I contribute to this job, even though I need accommodations or even though I will at times have lower productivity. If you removed that employer from the picture or you removed the agency that's providing me support, I would not be able to work and earn over SGA. IRWIs and subsidies are just identifying the extra supports that propel you to work and earn over the SGA amount. It's your choice. You don't have to identify them and apply for these work incentives. But if you're somebody who's not yet ready to let go of your SSDI benefits and you need that time to get stable on the job and to brace yourself for the future loss of benefits, then these work incentives can be very helpful and very powerful. When you're documenting a subsidy, you want to make sure that you're looking at whether or not you're going to have your employer involved. If your employer is involved, it's really easy. The employer completes a form for Social Security, and they identify what the value is of the support that you're receiving. If you don't want to do that, you're going to have to work with your Social Security claims rep and advise them that you don't want your employer involved, and it's going to be just a little bit more complicated. When an agency is providing the support, it's pretty simple because agencies tend to document all of this activity through their case notes. When you're reporting an IRWI or a subsidy, I really recommend that you do this the first month that you're reporting wages. Sometimes folks think, well, I'm working and they take out Social Security taxes, so they must know that I'm working. But it really doesn't work that way. You have a responsibility when you return to work to go to the Social Security Administration and report your wages. You can do this in a number of ways, but if you're going to be reporting IRWIs and subsidies, I really recommend that you make an appointment with your local Social Security office and you go in to meet with your claims rep and discuss how they would like you to report these IRWIs and subsidies and with what frequency they would like that done. You're going to want to go in with all of your pay stubs. You're going to want to go with information about where you work and the location and things of that nature. You're going to want to make sure that you have receipts for the IRWIs and you're ready to explain why you need it to go to work because of your disability. And you're going to want to go in prepared to talk about the subsidies that you're receiving, the extra support on the job, and how you and the claims rep together are going to verify that. You want to make sure that you ask the claims rep with what frequency they want you to report because that's going to be very important. And you also want to make sure that you have a conversation with them about how you're going to be able to document that you reported and that these IRWIs and subsidies were applied to your record. So what generally happens when you return to work is you go through the trial work period and then you head into the extended period of eligibility. And remember, during the extended period of eligibility, Social Security is consistently wants to check to see, are you working over the SGA level or under the SGA level? If you work over, you're not entitled to your cash benefit. If you work under, you are. And you have the work incentives that you can apply so that even if you are working and earning over SGA, it may count as less. At the end of the 36 months, though, Social Security will look to see, are you working and earning over SGA? If you are, that is the time when you are most likely to come off of the roll. Social Security provides a little bit of a grace period within that 36 months. The first time you hit SGA and the next 2 months, it's the grace period, and it's a time when you'll receive your cash benefit no matter how much you're earning. But individuals often go through this 36-month period, and then beyond that time, the first time they go over SGA is when they hear from the Social Security Administration that they're no longer eligible for their SSDI cash benefit. That can be a really scary thought. So it's really important that you understand that that's the future of what can happen, and you make your own decisions about what level of work you're going to engage in, whether or not you have work incentives to apply, and what you want this work attempt to look like. We really haven't talked at all today about self-employment, which has its own modified set of rules. So if you're interested in self-employment and you're on the line, I would ask you to reach out to us after this webinar, and we'll provide you some resources on that. One of the greatest concerns when you go through the extended period of eligibility and when you consider this risk of losing your SSDI cash benefit is what will happen to my health care. And extended Medicare allows for SSDI beneficiaries to continue eligibility for Medicare coverage for up to an additional 93 months after the trial work period. During this time period, hospital coverage is automatic and cost-free, and outpatient coverage continues to be optional and subject to the 2013 premium payment of $104.90 per month. Hospital coverage is that Part A, and outpatient coverage is Part B. So you are going to have access to Medicare for about 8.5 years. And Social Security ultimately assumes that because you're making a return to work, you're going to have the option to pick up health coverage through your employer. In many states, not in every state, but in many states, there are what's called Medicaid buy-in programs. So as you return to work, as soon as you return to work, you're going to want to consider participating in your state's Medicaid buy-in program. We gave you a link. There's about I think there's 23 to 30 states that offer Medicaid buy-in programs. My own home state of Florida doesn't, so there are states that don't. But Medicaid buy-in programs are a critically important component of your return to work. They're a way that you can receive Medicaid coverage because you're a person with a disability who has wages. So the programs often require that you be working. And the benefit, not only do you get Medicaid, but you will be allowed to keep your Medicaid up to higher income and asset levels than your traditional state Medicaid program. It's called a Medicaid buy-in because in many states, in receipt for access to Medicaid, you pay a premium. But some states haven't figured out how to do that, so they're not charging. And in most states, the fee is is actually pretty nominal and affordable for most people. You do want to be careful and look into the Medicaid buy-in program in your state even before you return to work. The current state I live in, which is Virginia, has a Medicaid buy-in program in which you really have to apply once you get word that you've been offered a job. If you wait until you're paid, you could income out of the buy-in program. So you want to make sure that you're looking into a Medicaid buy-in program as soon as you start thinking about making a return to work, and utilize it as part of your own determination of whether or not this is the right next step and what your options are going to be. Should you come off of your SSDI, of the SSDI roles, and you want to come back on, Social Security has a work incentive called expedited reinstatement. Expedited reinstatement is for individuals who lose their employment or have to work less than SGA because of their disability. So if you quit your job just because you didn't like it or it wasn't something disability related, expedited reinstatement may not apply to you. But expedited reinstatement allows you to let Social Security know within 5 years of coming off the rolls, I would like to return. I am no longer working at SGA, or I have lost my job because of my disability. You will receive 6 months of provisional benefits while your case is being reviewed. And if you are found not to be disabled, then you do not have to repay the provisional benefits. In addition to expedited reinstatement, you also have the option of reapplying for benefits, and you have that option at any point in time. But expedited reinstatement can be very beneficial because you get those 6 months of provisional benefits. So you don't have to wait. Many of you know the process of coming onto the rolls can be lengthy. You don't have to engage in that again. You can do just what they said, use an expedited process. Another tool that you have as you consider your return to work is Ticket to Work. And one of the reasons why it's important for you to consider Ticket to Work is not only because it's a program that provides you access to employment networks, which are workforce development service providers, folks that are interested in helping you get back to work, but also because if you use your Ticket to Work and you're actively working on a plan for employment, then you have suspension of your continuing disability review. So if you remember back in the beginning, we talked about the fact that anyone who comes onto the SSDI rolls is going to be asked to do a continuing disability review. Social Security is going to be checking every so often that you haven't medically improved. And sometimes for different disabilities, the medical improvement can come at a time when you're really getting back to work and it's the worst time to be checked to be medically improved. And Ticket to Work can really be a great tool for that because it will suspend that continuing disability review. So you can make your return to work without fear that during your return to work you're going to be found to have medically improved and no longer have access to your benefits based on medical improvement. The Ticket to Work, just to share a little bit more about the program, is a voluntary program. You don't have to participate. But again, it can be very beneficial, especially if you have a disability that has ebbs and flows, such as MS. We're going to talk about Ticket to Work again in just a few minutes. So before we go on to some supports to assist you, I want to take a few minutes just to recap on what we've discussed about Social Security disability insurance. As you recall, Social Security disability insurance is one of 2 Social Security Administration disability programs. The 2 programs do not work the same, so you don't want to get them confused. Folks who apply for SSDI have to show that they have a documented medical disability that will last 12 months or longer or result in death, and because of that disability, they are not able to work and earn at a substantial level. To qualify for SSDI, you also have to show that you have enough FICA credits, you have paid into the system, or if you don't have enough FICA credits, that you are a DAC, which means you were disabled before age 22, you are not legally married, and one of your parents, their record is open, so they are deceased, disabled, or retired. You want to remember that SSDI comes with Medicare, Individuals wait 24 months for their Medicare to start. They also wait 5 months for their SSDI cash benefits to start. SSDI has no asset limit, but SSDI is very focused on your earnings, and they're very focused on whether or not your earnings are above the SGA level. When you return to work, you get a trial work period, which is 9 months over a rolling 60 months, where you're allowed to earn any amount of money and still keep your full cash benefit. It counts as one of the 9 months if you earn $750 or more in 2013. And as soon as you use up your 9 months, your trial work period is over, and you move on to the next period, which is the extended period of eligibility. The extended period of eligibility is 36 months all in a row. The clock is ticking whether you're working or not. Each month you're looked at to see if Social Security looks to see are you working over SGA, which for blind individuals this year is $1,740. For non-blind is $1,040. If you're working over SGA or $1,040, you are not entitled to your cash benefit. If you're under SGA, you are. There are 2 work incentives that allow you to work and earn over SGA and have it count as less. The first is impairment-related work expenses. These are items you pay for yourself to go to work because of your disability. So anything that you pay for yourself to go to work because of your disability, you want to submit as a possible IRWI. The second is a subsidy. This is additional support that an employer provides or additional support that an agency provides. And I just want to remind you that although it doesn't sound wonderful to say that you're getting this extra support and that that's what supports you in working and earning over SGA, these work incentives can be a very powerful tool in helping you to identify whether or not it's the right job for you, it's at the right pace, at the right pay, and it gives you some time to become stable on the job before your earnings exceed the level where even with deductions you're over the SGA level. So please consider using IRWIs and subsidies. At the end of the 36-month extended period of eligibility, if you're working and earning over SGA, that is the time when you may come off of the SSDI rolls. You will no longer be eligible for your cash benefit. Your Medicare will continue for about 8.5 years beyond the trial work period. And if you are in a state with a Medicaid buy-in, you may also have access to that Medicaid buy-in program for as long as you're working. If you come off of the rolls and you need to come back on, you have 2 options. One is expedited reinstatement. Expedited reinstatement allows you to request to come back on the rolls because you have lost your job or you're now working under SGA and it's been less than 5 years since you lost your eligibility. Expedited reinstate will provide you 6 months of provisional benefits, and Social Security will determine whether or not you're still eligible. If you are, then you come back on the rolls. If you're not, you don't pay back the 6 months of provisional benefits. The other option you have to come back onto the rolls is a reapplication, and you can do that at any period of time. So that is SSDI in about a minute. Again, I know that this is a lot of information for you to get in one webinar, so I want to invite you to submit your questions and to be ready to send us questions as you need to after today's webinar. There are quite a few supports to assist you as you think about your return to work, and really one of the most important is on the slide in front of you. Work Incentive Planning and Assistance Projects. Work Incentive Planning and Assistance Projects have been around since the passing of the Ticket to Work and Work Incentive Improvement Act, which was back in about 1999. These programs used to be called Benefits Planning Assistance and Outreach, and now they're called WIPA, Work Incentive Planning and Assistance. WIPA programs provide community work incentive coordinators within your local area or covering a region, And these individuals are folks that are trained by the Social Security Administration to provide you quality information about your work incentive so that you can make a decision to work, understand the effect of employment on your benefits, and better understand work incentives and the different referrals to other supports that you may need. Work incentive planning and assistance providers can do a little bit like what we're doing today, only they're not going to talk in general. They're going to talk about your specific situation. What does your specific DPQY look like? How many trial work months have you used? What is the impact of that on your planning in your return to work? They can also give you guidance on the work incentives that you can use. They oftentimes know the folks at the local Social Security office and can help you connect to the right claims representative, and they can give you advice should you come upon any challenge in engaging with the Social Security Administration. Work incentive planning and assistance projects provide services to SSDI and SSI beneficiaries between the ages of 14 and 65, also to parents and guardians, service providers, and to other supports. There's a list of providers on the link we provided to you, and if you go to that link, I just want to advise you to scroll down the page. There's a map at the bottom, and by clicking on your state, you're brought to the information on programs in that state. Going hand in hand with work incentive planning and assistance projects are protection and advocacy services. The Social Security Administration provides funding to both WIPAs and what's called PABs, Protection and Advocacy for Beneficiaries of Social Security. And again, the protection and advocacy services are available on the same website, the same page, but remember to scroll down to get that picture of the states and click on your state. Protection and advocacy can do so much more for you than just focus on your Social Security benefits. They're part of larger protection and advocacy organizations that typically provide information on access to community services, special education and transition services, transportation, housing, health care, your disability benefits and work incentives, your rights under the ADA. They can handle issues on the job, and they can really provide significant support in helping you better understand your rights should you come up against barriers in your return to work. Also, if you're participating in a vocational rehabilitation program, which we're going to talk about in a few minutes, or you're participating with an employment network and you come upon a challenge in working with them, protection and advocacy can also be your place to turn to support your client's rights in those situations. We're going to talk for the next few minutes about doorways to employment supports. You know, it doesn't do us a lot of good to talk about SSDI benefits and the fact that you do have room to return to work, and there are provisions within SSDI that allow you to work and potentially maintain your benefits at least for a period of time. But some of you on the line may be thinking, well, I'm interested in making a return to work, and I'm going to go and meet with a WIPA, but I'm not sure where to turn to in help in returning to employment. So we wanted to provide you some information on different employment supports that are available in your local community. The first we want to talk about is state vocational rehabilitation programs. The VR program is a state-federal partnership that supports the employment of people with disabilities. Their mandate is really to help you obtain and maintain employment. So they can help you to identify your employment goals. You can do some assessments to see maybe you haven't returned to work since your diagnosis and you're not sure you can do the same job. They can help you to assess where your skills lie, what your aptitude is, maybe to change fields. They can also support you with training and further education, and they can provide you access to assistive technology and other employment supports. We gave you a link to all of the different state agencies. When you look at that link, you want to be sure, as noted, to click on Other Useful Contacts, and that will bring you to a list of all of the states, what vocational rehabilitation is called in your state, because it can be called something different from state to state, and where you should turn to start to explore vocational rehabilitation in your own state. A second opportunity that you have is from the Department of Labor. They're called American Job Centers. American Job Centers used to be called one-stop centers. In some areas, they're called workforce centers, but their official title under the federal recommendation is American Job Centers. These are community centers that provide employment services, education, and training services all in one place. You can go there to participate in different training programs. If you're not sure you need a lot of help getting a job, but you would like to brush up on your computer skills, or you'd like to rework your resume, the local American Job Center could be a great place to turn. If you noticed in your community there are some emerging fields that you're interested in exploring, the American Job Center can be a great place to do that. You may also find that you're in a location where some new businesses are coming in, and when that happens, the American Job Center is often where those businesses look to help them hire people for these new establishments. So if you've never gone to explore your local American Job Center, I encourage you to do that. They can be a wealth of information and support for you. A third opportunity is your local Independent Living Resource Center, also called Centers for Independent Living. These are grassroots, advocacy-driven organizations run by and for people with disabilities. They're funded in the same way that vocational rehabilitation is funded, but they have a mission to provide 4 core services: individual and systems advocacy, information and referral, peer support, and independent living skills training. So as you can see, they can provide you information and support even beyond employment, but they're oftentimes an excellent resource if you're newly disabled or you're not really sure about how the disability system works. Your local Center for Independent Living can be a great first step. You can locate an independent living center by clicking on the link we've provided for you. It may also be somewhere that you can find peer support, or you could offer peer support. We mentioned earlier the Social Security Ticket to Work program. Now, the Ticket to Work program has been around for a long time now. It's been about 14 years. And sometimes people really aren't sure about how this program works. So I want to take just a minute to give you a little bit more information about this and to encourage you to click on choosework.net for videos, for more benefits training, and for lots of great information on the Ticket to Work and whether or not you might want to use your own ticket. So individuals who receive SSDI and SSI and are within the proper age range are typically eligible for a ticket to work. At one point in time, you may have received a ticket in the mail. You may not know where that is anymore, but you don't really need it. The ticket was just representative of the fact that you are part of this new program. The Ticket to Work program is completely voluntary. You're not required to participate, and it does a few things for you. One, it gives you access to service providers called employment networks that you can go and vet, meaning you should shop around, you should talk to multiple employment networks and determine which is the right one for you based upon who can provide you the type of services you need to return to work. As you return to work and work at increasing levels of pay, the employment network receives money from the Social Security Administration. So they're in it with you. If you don't succeed, the employment network doesn't succeed. The one benefit that you receive, in addition to having access to employment networks, is that you will not have a continuing disability review as long as your ticket is assigned and you're working towards your employment goal. So when you assign your ticket, the service provider, the employment network, completes an employment plan with you. It's one that you both agree upon together. And as you're working towards that plan, as long as you're working towards it, you will not have a continuing disability review. So again, suspension of that continuing disability review can be a real benefit, and it's one of the strongest reasons why you should consider assigning your ticket to work. But for more information, I really encourage you to check out choosework.net. They have testimonies from people that have participated in the program. They have more information about benefits, and they do other webinars about benefits, and just a host of information that can be really helpful to you. Also on the ChooseWork website is information about the federal hiring of people with disabilities. The federal government provides employment opportunities for individuals with disabilities through what's called Schedule A hiring. Schedule A is a hiring authority available to the federal agency that allows them to hire individuals with disabilities without them competing for a job. Sometimes that means that they will accept resumes and consider people when there's not a job open. But there's more information available on the 2 links that we posted. If you're living in an area such as I do here in the D.C. area where there's a lot of federal employment, if you've never taken a look at Schedule A, I would really encourage you to. But as you know, most communities have some federal staff within them, and so this is a great possibility for anybody who is interested in possibly working for the federal government. Oops, sorry about that, everyone. So as you consider your return to work and you download the archive of this webinar, we wanted to provide you all of the working resources in one shot. So if you're just interested in checking those out, you can print out just that page. But again, it can be very helpful as you're thinking about a return to work, not only to consider what is the impact on my benefits, but also to consider what's the job market look like. Other than what I hear on the news, what kind of support is available for me to rework my resume, to gain new skills, to maybe get post-secondary education or to further my education, and to just better understand what the opportunities are within my local area. We'd like to encourage you to take some next steps and register with one of the employment supports we noted above. You could do that with vocational rehabilitation, with the Department of Labor one-stop centers or Workforce or American Job Center, whatever it's called in your local area, or to do it with the Ticket to Work program. We also want to encourage you to meet with a benefits planner. Benefits planning can be incredibly helpful as you think about whether or not moving off of the Social Security rolls is the right option for you. We know that it can be incredibly scary to think about whether or not you want to give up SSDI. It's really been a safety net, and for many folks, it's really been the only income coming in. So the thought of giving that up can be incredibly challenging. But a benefits planner can help you to make a better choice about whether or not it's the right choice for you and what the steps are, where you are in the process, whether you've used up your trial work period or not, or whether you've already have gone through your extended period of eligibility. All of those can be key factors in helping you determine whether or not you want to move forward and at what level. We'd also like to encourage you to review the previous financial wellness webinars to determine your earnings goal. One of the things that can often happen when we receive SSDI is we get very focused on not losing the SSDI benefits instead of thinking about how you can successfully transition off the rolls. I know that may not make a lot of sense when you first hear it. How do you successfully leave behind the rolls? But part of what we want to talk about in financial wellness is how you identify yourself, what your own financial life is going to look like. What lifestyle do you want to live? Is there a potential to get back to where you were before you were diagnosed with MS or before you incurred another disability? Are there goals that you have for yourself that are deterred because of the limited income that you have now? And what are some opportunities to increase that income? You know, today we only talked about wages, but SSDI has other roles for self-employment, for micro-enterprises. There's a lot of opportunity even beyond traditional wage employment that it can be very impactful to learn about. So we'd like to encourage you to take a look at some of the previous webinars and to consider what do I really want my financial future to look like, and what would it take to achieve those financial goals. Some of those you can do without more income, and some of them you can't. And so before you go and talk to an employment provider, it would be incredibly powerful for you to think about what earnings do I need? Really, if I'm going to make a difference, if work is going to make a difference for me, how do I get to the earnings level that I need? It may be the need to transition off of SSDI, or it may be a combination of SSDI and wages. It's going to be individual to you, and it's a decision that only you can make. So these service providers you meet with can't do it. It's really something only you can do yourself. So we'd like to encourage you to take those 3 steps. Think about your earnings goal and determine for yourself where you'd like your income to be. Register with one of the different employment programs that are available and meet with a benefits planner. Those are the 3 steps that we'd like to ask you to complete over the next few months. And then we're going to ask you to share your experience with us. We're really curious to know, did you meet upon any barriers? Was the information useful to you? Was it helpful? Were there other things that you really needed to know before you went down that path? And how did it work out for you? So we know that you're not going to accomplish everything in 3 months, but we hope that you'll have a chance to get started, and we hope that you'll be open and willing to share some of that information with us in the near future. So we have some questions that have come in. Before we get started, I'd like to take a minute again to thank our sponsor, Acora Therapeutics. We really are so grateful to Acora Therapeutics. They've been supporting this financial wellness series for some time, and the evidence that this information is still needed. I know you guys can't tell, but there's over 200 of you on the line today. So this is information that is critically needed in the community, and we're just so grateful to be able to provide it to you. So we have some questions that have come in, and I'm going to take a chance to answer as many of them as we can. We have a good amount of time. Some of the questions may get a little bit personal, and in that case, we're going to email back to you privately. So if you have a more specific personal question, I'm going to ask you to, I'm going to put up my email address so that you can contact myself or my colleague, Katie Metz, and we will take the time over the next few days to provide you some answers. But any personal questions you have, we're not going to be able to get to them through the chat box. So please take the time to email myself or Katie Metz, and we'll strive to get you as good an answer as we can. Okay, so we had many questions come in, and one of them is, how or why would someone qualify for both SSI and SSDI? That's a great question. So an individual can qualify for both SSI and SSDI. SSI has different rules, which include that a person meets specific income and asset limits. So sometimes when a person gets an SSDI check, their SSDI check is less than the SSI income limit. So it's possible that someone could qualify for an SSDI check and then also qualify for a small SSI check. Sometimes what happens is as the person returns to work, they may work at a level where they are below SGA, so they're keeping their SSDI check, but their earnings, because of the income limit on the SSI side, cause them to lose the SSI. So if you are someone who receives both SSDI and SSI, I want to encourage you to not just consider what you learned on today's webinar, but you are someone who absolutely needs to go and meet with a benefits planner. People who get SSDI and SSI have to abide by both sets of rules because the SSDI rules apply to the SSDI and the SSI rules apply to the SSI. It can get very complicated. So if you're not very savvy or very knowledgeable, if you're not really an expert in Social Security benefits, I wouldn't try to give any advice to someone who gets both SSDI and SSI, and if you're someone on the line, I would highly encourage you to meet with a benefits planner. Another question is, are individuals with mental health diagnoses considered disabled, and would they qualify for SSDI? Social Security doesn't discriminate based upon the actual kind of disability a person has. What they're looking for, again, is do you have a documented disability that will last 12 months or longer or result in death? And because of that disability, are you unable to work at a substantial level? So the actual diagnosis could be MS, as we've been discussing, mental health, traumatic brain injury, Down syndrome. It could be anything as long as it meets Social Security's definition of disability. It's going to be a documented medical disability that will last 12 months or longer or result in death, and because of that disability, the person can't work and earn at a substantial level. The next question is, why is the trial work period amount smaller than the SGA amount? And the answer is, I don't really have a factual answer on that. It is the way that it works every year. I wish that they did not do that. I think it would be much simpler, but many of Social Security's rules are based on something that actuaries determines within the halls of the Social Security Administration. So if it's something that you'd like to see changed, I really encourage you to write into the Social Security Administration and make that suggestion. Another question is, does the extended period of eligibility apply to any back pay owed? So I believe the question is, when you're looking to see are your earnings above or below the SGA amount, will Social Security take into account the back pay that they may owe you? Remember, sometimes Social Security may, you wait 5 months for your Social Security benefits to start your SSDI, and so oftentimes people do get back pay. The extended period of eligibility, and any time we talk about SGA for SSDI, you're only talking about earnings. So it's not other money coming in, it's only earnings. So another question that came in is, if you invested your money in an IRA or a 403B or a 401K, would that money count as SGA? So the money that you earned to put into those accounts counts towards your SGA. The money that you have in those accounts, the interest accrued, those do not count. Social Security only counts your earnings. Another question is, are service animals an IRWI or a subsidy? Service animals do count as an impairment-related work expense. So the cost the cost related to your service animal can be deducted as something you pay for yourself to go to work because of your disability. Another question we had, sorry folks, sometimes I'm reading the question and I have to interpret what the question meant, so it takes me a minute. Another question was, just to recap, you said that Medicare will last 8.5 years, not Medicaid, right? And SSDI comes with Medicare. So some of you on the line may be receiving both Medicare and Medicaid. If you're someone who's received SSDI, it's your Medicare benefit that comes with your SSDI. Sometimes when folks are waiting 24 months to qualify for Medicare, they find that they qualify for a Medicaid benefit under different state rules. So when you are thinking about your extended eligibility under SSDI of the health care, that health care is Medicare. Your Medicaid benefit from the state has different rules. And if you are someone who's receiving Medicaid from your state and you're thinking about returning to work, you didn't get good information today to make a decision about your Medicaid. You're going to have to get some information either from a benefits planner who understands your state Medicaid rules or from your state Medicaid program. Those public benefit rules are different, and we did not discuss those today. Another question that was asked is, if I have doctor's costs, but I have Medicaid that pays for it, can I still deduct it as an IRWI? And unfortunately, you are not able to deduct it as an IRWI. An IRWI is used for items that you pay for yourself to go to work because of your disability. So if your insurance or if another support is paying for it, then it would not qualify. So a lot of you on the line requested information about SSDI and self-employment. We seem to have gotten a lot of questions about that. I want to be candid with you and say that the self-employment rules for SSDI, they take another level of expertise, and it's be very difficult to talk about it on the line today. But it can be a wonderful opportunity for individuals to consider self-employment because it does provide some more room to work, Social Security doesn't just consider SGA. They will take a look at your net earnings. Anytime we talked about earnings today, we were talking about gross earnings. And when Social Security looks at self-employment and SSDI, they look at net earnings. So that can be a real benefit. There's a lot of great resources for self-employment. If you're anxious to get a look at something now, and you can Google Startup USA, that's one wonderful reference point that you have. There's also an extremely successful organization that does a lot of self-employment for people with disabilities. It's called Griffin Hammis Associates. And anybody who's interested, please feel free to send me an email, and I will provide you with self-employment resources so that you can explore that. Another person asked, is there a detriment to working and earning over the SGA amount during the trial work period? So the trial work period says that you can earn any amount of money and still maintain your full cash benefit. But one of the challenges is that as you are working and earning over SGA, you're not likely, I don't know why you would stop at 9 months. You would likely continue to work and earn over the SGA amount. So you are going to be creating a pattern in which you're demonstrating to Social Security that you're able to work and earn over SGA. So the Social Security Administration doesn't do anything in real time. I think that's something it's important to understand. So when we talk about Social Security looking at your monthly earnings or looking at your trial work period, I don't want you to think that every month your earnings come into the Social Security Administration and they stop and they check to see where you are in the process. They don't do that. They really look at things in the past. So a rolling 60-month period for the trial work period means that Social Security looks 5 years back to see over the past 5 years, have you used up your 9 trial work period months. And then they'll look at a period of time to see within that time during the EPE, are you over or under? This is why a lot of times when people return to work, they end up with overpayments. It's because Social Security doesn't operate in real time. They really look towards the past. So it's important for you to consider that you're going to have to know for yourself whether or not you are eligible for your cash benefit. Because you may find that you are working and earning money, maybe you're earning over SGA, and you know you shouldn't be getting a check, but you still receive one. That's one of the great challenges with the system currently. Social Security is making efforts to improve that, but I want to make sure that you understand that that's one of the challenges that you're going to face. And you will get good advice from benefit planners from the Work Incentive Planning and Assistance Program on how you can manage some of that. But I want to make sure you know that Social Security isn't just looking at one period of time. So one of the challenges, if you do choose to work and earn over SGA during the trial work period, is I don't see any reason why you wouldn't continue to do that. So as you continue to do that into the extended period of eligibility, you are demonstrating that you're able to work and earn over the substantial gainful activity level. So you are creating some documentation that you do not really meet Social Security's definition of disability. So if you want to do that, it would be really important to look at what work incentives are available to you, or to consider that you are going to be making an effort to eventually come off of the rolls. We got another question from folks asking they're still a little bit confused about how the 1040 is calculated. The 1040 is your gross earnings in a month. So we're not talking about net, we're talking about gross. So before taxes, your gross earnings. So one of the questions that was asked, if you use only 6 months of the trial work period in a 5-year period, does the 9-month trial work period start over? And the answer is not really. So it's 2013, right? So if Social Security was looking back 5 years, they might look at 2013 to 2009. That would be a 5-year period. And let's say within those 5 years, I used 6 months. Social Security would say, okay, she didn't use up 9 months in this 5-year period, so let's roll back one. So between 2012 and 2008, did I use up 9 months? That's how they do it. That's what they mean by rolling. So the time period rolls, and Social Security looks to see within a rolling 5-year period, have I used up 9 months? So it can be a little bit tricky. Sometimes folks think if I haven't used them up, I get to just start over. And I wouldn't want you to walk away thinking that. That really isn't true, which is why asking for your benefit planning query is really so important, because that way you can see what Social Security has documented for you, and also you can make any corrections with them if some of the information is wrong. We've gotten some questions in about money that you don't earn, and so I just want to say again that what Social Security is interested in is money that is earnings. So if you do have, rental property, if you have investments, money that is not earned is not what SSDI is looking at. So I think that's important to note. Another person asked, can you use public transportation? If you use public transportation, is that considered an IRWI? So Social Security would consider public transportation an IRWI if your disability prevented you from driving. So if you use public transportation because you can't afford a car, then Social Security doesn't consider that disability related. But if you use public transportation because you're not able to drive, or you're no longer able to drive, or it's not safe because of your disability for you to drive, then that would be considered an IRWI. But I really recommend anytime you have something that you view as, I pay for this myself because of my disability to go to work, that you bring it in and that you work with the claims rep to see if it's going to be approved. Speaking of that, I just want to give you a little bit of information that we haven't shared previously. Sometimes when you go in and work with the claims rep, you may find that the individual doesn't have a lot of information or understanding about Social Security's return to work rules. And that can be a real point of frustration for folks. But it's important to remember that Social Security has prioritized some of their work. And their priority is to help people who need to come onto the rolls to complete the paperwork, get evaluated, and come on. So their priority is helping people who are, like you were at some point, out there just trying to get on the rolls to get on. So when folks come in and they're returning to work and things like that, sometimes it's not the priority of the Social Security Administration, the local office. So sometimes you may get varying levels of knowledge and support in making a return to work. Each local office has what's called a work incentive liaison. So if you find that the person that is your claims rep is struggling to understand why you're working, how it is that you as a person with a disability is able to work, they're not familiar with the work incentives that you're requesting, you want to find a way to politely ask for the work incentive liaison. Or even better, when you meet with the local benefits planner and they give you their own advice on how to claim your earnings and claim different work incentives, you might want to take a moment to ask them, how does our local office deal with this, and am I going to need to talk to the local work incentive liaison? Those folks are available in every office, or sometimes they may be available amongst a region of offices, but their role is to better understand the work incentives so that people can get good information about making a return to work. There's also, for those of you that are providers on the line, there are area work incentive coordinators in each state. Sometimes there's more than one, and they can be very helpful in helping to deal with bigger system issues or helping you if you need to connect with specific resources within the Social Security Administration. Okay, we had another question that asks, what about past plans? Isn't there a work incentive called a PASS plan. So a PASS plan is a plan for achieving self-support, and it's really offered under Supplemental Security Income, or SSI. It's not really an SSDI work incentive. It's really an SSI work incentive. Now, I have to say that because those are the rules, but I also want to say if you're on the line and you receive SSDI, a PASS plan may be an option for you. A PASS plan allows a person to set aside income and resources towards a specific work goal. So how this works for people that get SSDI is sometimes people can set aside enough of their SSDI or their SSDI and earnings to qualify for SSI. So it means that you'd have to be somebody who is going to be able to live off of an SSI benefit plus maybe about half of your earnings. That's the way the SSI formula works. I don't want to tell you how much that is because depending on the state you live in, there may be an SSI state supplement. So if we just talk about federal SSI, some of you may get the wrong idea. But if you're somebody who is interested in a specific work goal, particularly all of you that are interested in self-employment, then I think this was a great question. You may want to think about whether or not you could qualify for SSI by writing a PASS plan and setting aside some of your income and resources into that plan towards the achievement of your work goal. There's a website that can help you understand PASS and start the process of thinking about what is my employment goal and how might PASS work towards helping me achieve that goal. And that website, Nikki, if you could put it in the chat box, is www.passplan.org. The folks at Cornell who are excellent, excellent benefits advisors and have created a lot of great tools, created this website, and I'm just, very enamored with the job that they did. It's a wonderful website, and it works electronically, so you can start your plan, you can explore the website, and you can even start writing the plan and save it so you can come back to it at another point in time. I want to clarify, though, PASS is not an SSDI work incentive, but if you're somebody who can set aside enough income and resources into the plan that it would make you eligible for SSI, then you may be able to utilize a PASS plan even though you are an SSDI beneficiary. So we have time for just one more question. And the question is, what if you hit SGA for only 1 month of work and then you have 2 months which you were under SGA? And this question really speaks to what Social Security has created between the trial work period and the extended period of eligibility. Social Security was, in my point of view, thoughtful about the fact that when you are an individual with a disability who has been out of the workforce and you attempt to return to work, you don't always find the right job match right away. So both the trial work period and the extended period of eligibility allow for that ebb and flow of work. So during the trial work period, if you return to work and you are working below 750, it counts for nothing. If you work and earn over 750, you used up that month. If the next month you're under, again, it counts as nothing. You only use up trial work period months when you work and earn over the trial work period amount for that year, and this year that amount is 750. When you move into the extended period of eligibility, again, it allows for that ebb and flow. If you're over SGA and you don't have work incentives to bring you under, then you're not eligible that month. If you're under SGA, then you are eligible for your full cash benefits. I think where we really get into a challenge is once you go beyond the extended period of eligibility. Now, a benefits planner will be able to give you better information or more individualized information about how you can use different tools to show that if you go over, say, 1 month beyond the EPE, that doesn't demonstrate an ability to work and earn over SGA. But the Social Security Administration the way that they write their rules and the way that different Social Security representatives have encouraged me to talk about them is that if you go through the extended period of eligibility and you work and earn over SGA beyond those 36 months, you put yourself at risk of coming off. So I know it's not a very black and white answer, but that's what I want to leave you with. Social Security is really gray. And the best thing you can do for yourself is understand the rules to the best of your ability and then seek to push the boundaries of those rules as much as you can. Ask for any IRWI, anything you pay for yourself to go to work because of your disability. Document any additional support you get on the job. But learn about these benefits, meet with a benefits planner, think about your own earning potential, and make your own decision for yourself about what your return to work may look like. Again, as you would like more information, please reach out to myself, Elizabeth Jennings, or Katie Metz. I want to thank you again for joining us today, and thank you again to our sponsor, Accorda Therapeutics. We're happy to help you as you seek to better understand not only your public benefits, but your pathway to a better financial future. Thanks, everyone. Have a great day.